Welcome to Tuesday's edition of COVID-19. As expected, our daily tally has rebounded well above 500 today. We have more on this tally, as well as on the rewards and risks of vaccine incentives later on in the program. Here first are the pandemic updates with our Kwon Soa. Now, Soa, what appears to have raised our daily tally today?
Well, Sunny, that's most likely due to the higher number of tests with the beginning of the work week. Now, over 50 more cases have been reported than the Monday this Tuesday at 541. And with that, also the number of domestic transmissions has risen back to the 500s. And if we go over to our graph now, we are seeing fluctuations between the high 400s and also the high 700s. And the total number of cases here in the country stands at 124,269, and also 6 people have lost their lives in the past day. And also, let's get a quick update on the vaccination front. A little less than 7% of the nation's population has now received at least one shot of the COVID-19 vaccination, and the government has also vowed to fasten that process. Our Lee Kyung-in will have more details on that in a bit, but let's also get a check on where the new cases have occurred this Tuesday. We've got triple digits in the capital Seoul and Gyeonggi-do province, and 17 all provinces or major cities have reported at least one case of the variant, even here down on Jeju Island with 8 new cases.
So I also understand there are growing concerns here in the country over the presence of variant cases.
Right, Sunny. The government says variant cases account for almost 15% of recent infections, and that proportion being in the double digits for the second straight week now. And especially concerns are down in the southeastern city of Ulsan, where the UK variant, known to be around 1.7 times more contagious than the original coronavirus strain, appears to be the culprit in recent resurgences linked to chain transmissions from the variant. Around 770 cases were reported in April alone, which is more than the city's caseload for the entire year of 2020. Meanwhile, more than 170 South Korean nationals in the hotspot of double and triple mutants, India, have returned home this Tuesday, with more to arrive later this week. Along with certificates that prove they tested negative for COVID-19, they must stay at government-designated isolation shelters, that is, for 7 days. Now, the World Health Organization is monitoring 7 variants of interest and 3 variants of concern, with officials saying their new variants, of which not all are important, are being identified every day. Now, with that fast and furious identification of variants, also the number of global infections is rising at fast speeds. And here's WHO chief more on the details.
More cases of COVID-19 have been reported globally in the past 2 weeks than during the first 6 months of the pandemic. India and Brazil account for more than half of last week's cases. But there are many other countries all over the world that face a very fragile situation.
Now, as the WHO had just mentioned, India and Brazil, let's take a look at the numbers in those countries. India just hit 20 million cases in total, with over 350,000 new infections reported in just a day. Now, Brazil at 14.79 million reported some 36,000 new cases. And the total number of infections around the world stands at 154.1 million, with almost 700,000 cases in just a day. And those are the updates I have for now. I'll see you back in a bit after the briefing.
All right, so thank you for that. Right, authorities here have made public details of their second quarter vaccination agenda. I have Lee Kyung-in here in the studio with me with details on that. Welcome, Kyung-in.
Hi, Sunny.
Right, so a greater number of senior citizens will be receiving their first doses this particular quarter.
Yes, the government decided to expand its vaccination campaign to more regular citizens. Previously, it was planning to vaccinate those between 65 and 74 in the second quarter, but now that age bracket has been widened to 60 and 74, and they'll be getting the AstraZeneca vaccine. Inoculations will begin with the eldest, starting with people between 65 and 74 on May 27th. Those between 6 and 64 will be next in line, getting their vaccines starting on June 7th. Vaccinations have already started for people over the age of 75 who are receiving the Pfizer vaccine. The move is aimed at protecting people who are more likely to face serious health outcomes from COVID-19.
A total of 8.9 million senior citizens will be inoculated in the second quarter as part of our expanded vaccination campaign. This decision was based on the fact that those over the age of 60 were at greater risk of death and serious illness from COVID-19.
Teachers at daycare centers, kindergartens, and first and second grades in elementary school will also receive AstraZeneca shots starting June 7th. Also in June, essential workers like police officers and military service members aged below 30 will be getting Pfizer's vaccine. This comes following the suspension of the AstraZeneca vaccine on that age group due to the vaccine's link to rare blood clotting disorders.
Right. Now, Kyung-won, I also hear we'll be able to offer the first dose of the COVID-19 vaccine to more people by the end of June.
Yes, the government is trying to give first doses to at least 13 million people by the end of June. That is 1 million more than the country's initial plan of 12 million. That's now possible with the increase in vaccine supply. The country is set to receive some 14.2 million doses in the next 2 months for an aggregate total of 18.3 million by the end of June. That is a major boost in supply compared to only 4 million doses the country received in the 2 previous months.
A little over 18 million doses were scheduled to arrive in the first half of the year, but the advanced delivery of 230,000 AstraZeneca shots has pushed that figure to 18.3 million doses. The speed and scale of vaccine shipments are picking up pace.
Some 7.2 million AstraZeneca doses will arrive in the country between May 14th and the first week of June. 5 million Pfizer doses will also arrive in May and June, being shipped in small batches once a week. Also, South Korea will receive 1.6 million AstraZeneca doses and some 300,000 Pfizer doses from the COVAX facility by June. In addition to that, the government is currently in talks with Moderna, Novavax, and Johnson & Johnson to import their vaccines in the first half of the year. Altogether, the government is looking at a total of 192 million doses for this year, which is well over triple the country's entire population.
Well, Kyung-won, that sounds reassuring if realized, of course, but the next shipment of vaccines is set to arrive in the country in mid-May. So how are authorities planning to allocate their current supply?
Well, the government will limit the number of first-time recipients so that it can hand out second doses on time. Last week, authorities have already recommended vaccination centers to stop administering Pfizer vaccines to new recipients. Authorities stressed that this adjustment is only temporary, and they make clear that this does not hint at any delays in vaccine shipments. Take a listen.
The government's vaccine strategy is aimed at maximizing the number of first dose recipients using existing supplies, then administering the second doses with follow-up shipments. So inevitably, there will be repeated cycles when the number of first dose vaccinations outnumber second dose jabs and vice versa.
Although no exact date has been mentioned, authorities expect there will be some time around late May when it completes handing out second doses to more than 1 million Pfizer recipients. As for AstraZeneca's vaccine, the government will administer first doses to a final group of registered individuals by the end of this week. Then, starting next week, it will also temporarily halt the first dose rollouts of the AstraZeneca vaccine until the 27th.
I see. All right, Kyung-won, as always, thank you very much for the coverage.
My pleasure.
Right, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Tuesday.
First of all, we have Director Lee Sang-won with the explanation with today's briefing.
네. 방대본 역학조사 분석단장입니다.
Let us now begin our regular briefing for May 4th, Tuesday, on the COVID-19 response here in South Korea. First of all, as for the COVID-19 vaccinations, here are some updates. We have expanded the eligible recipients of the COVID-19 vaccination, and we are starting the process of receiving the reservations. And starting from the 5th of May, we will be receiving the reservations for those over the age of 70, and also the following week, the people in the age group of 60 to 65 will also be able to have applied for the receiving of the vaccines. And as for the places of vaccine rollout, they can also visit the designated hospitals, about 12,000 of them nationwide, and they can book their reservations in advance, and they will be administered with the AstraZeneca vaccines. And also, starting from mid-April, we have been rolling out the vaccines at these designated hospitals, and they also have the online reservations. And if this is difficult or challenging for some senior citizens, we also have designated call centers that will also help out the senior citizens. We also have designated employees at the regional offices who will also assist the senior citizens in making the reservations for the inoculation. And after the reservation, they also will receive a text message within 1 hour, and also they can check their reservations and also cancel or change their reservation dates online or through the call centers. And also, if they feel ill, they are also advised to change the date to another date, and we ask you to do this because this is important for your safety. And also, here are some updates on the efficacy of the COVID-19 vaccines. The quarantine authorities would like to note that COVID-19 vaccines, as for those over the age of 60, who have been administered with their first dose, and about 8.6% or 86% have also had the efficacy rates of the prevention of the infections. And also, looking at a study in Scotland, about 1.3 million people, we have also seen that after 4 weeks since the first dose inoculation, we have seen a decline of 89% in terms of hospitalization due to COVID-19. And we would like to note that there are also some in-depth analyses that will have to be done according to gender and age group. However, we believe that we have reaffirmed the importance and the crucial need for vaccination, as this is important to prevent the COVID-19 infections. And it is especially more important for the senior citizens above the age of 60 who are prone to develop critical symptoms or fatalities, and this is why we have expanded the eligible recipients of the vaccines to include those from the age of 60 to 75. And also, to this end, we have been carrying out the vaccine rollout for the senior group, and also as for the second dose recipients, we also aim to provide the vaccines for the senior citizens. And after we complete the second dose rollout, we will resume the first dose inoculations. And also, we would like to highlight that you need to receive your second jab within the given date, and by keeping to the interval of the first and second doses. And as for the Pfizer vaccines, we have had about 430,000 Pfizer vaccines to arrive here in Korea tomorrow. And about out of the 7 million, more than 2.5 million will also arrive here. And also, going forward, we will have the more Pfizer doses of the vaccines receiving here in South Korea on a weekly basis. And we would like to also provide some intensified quarantine measures for the new variants and also those coming in from India. And in order to bolster our monitoring for the new variants, we have been expanding our efforts. And as as for the foreigners, we have seen about 5%, over 5% in ratio of the confirmed cases. We are also looking at their genes to carry out the analysis. However, we have looked at about 15% cases of the new variants, and we have found a total of 91 more new variants as of last week. And now, a total of 632 new variant cases have been identified here after October. And a majority of the cases are UK variants, 71 are South African variants, and 10 are Brazilian variants. And throughout the past week, we also have seen the 97 new variant cases, and out of them, we have 22 imported cases. 9 of them have been identified at ports of entries, and also we also have one more case being identified while on self-quarantine in the community, and the rest of the 75 are local transmissions. And we are also witnessing a rapid surge in the virus infections in India, and this is why we will be bolstering our inspection for all of the people who are coming in from India. From today, we are also going to subject all of Korean nationals and also other people who are returning to Korea from India, and they will be mandated to be isolated at a designated facility for 7 days, and they also need to test a PCR testing. And as for the people, the foreigners who are staying here in Korea for a short term, we will mandate them for 14 days of quarantine measures. And marking the family month of May, we believe that during the weekend we will also have many group outings regarding family members. And to this end, we ask you to comply with stringent quarantine measures, especially for the month of May. And we believe that we have seen 219 cluster infections and regarding with families, and there were over 3,643 daily individual infections. And also this has been due to increase in the number of group outings regarding families and relatives, as well as the increase of visiting the multi-use facilities. And through family meetings and meetings with relatives, we believe that there could be a surge in the number of infections. And if you have any clinical symptoms of COVID-19, we ask you to refrain from going to work or going to school, or rather visit a screening clinic to get tested as soon as possible. You shall never visit a multi-use facility if you have symptoms. Moreover, within a family, if you live with elderly citizens, that is, you need to also encourage and help them to get vaccinated as soon as possible. And please go over the guidelines for the reservations before the inoculation, and even after inoculation, please monitor their health conditions. Tomorrow is the Children's Day, and also during the weekend, we celebrate the Parents' Day. And we believe that you would like to meet with your families and senior parents to enjoy a meal or have group outings. However, please note that the risks of COVID-19 infections could also be increased if you meet with these family members. And we have seen a decline of the daily number of infections. However, we believe that this could have a rebound at any time. It is very important that we need to comply with the basic quarantine measures in order to safeguard the health of yourself and others. And it is also very important that inoculation can also protect the community as a whole. So if it's your vaccination turn, please get vaccinated on the day when you have great health conditions. The quarantine authorities would also like to exert our full efforts to inoculate more than 12 million by the end of June, so that our community could return to our state of normalcy. Thank you very much.
Right, that was Lee Sang-won with Tuesday's afternoon briefing, and he placed greater emphasis on the importance of social distancing this month.
Right, and that especially because this month is, of course, May, where we have a lot of not only national holidays, but a lot of family-related days. So that is why he was asking for vigilance from the people and also to, cooperate in the vaccination plan. And the government's briefing is actually now more focused on the vaccination updates instead of the new infections that occurred. And the official Lee Sang-won said that according to the government's expansion of inoculation subjects from the 6th of May, which would be Thursday, registration for vaccination for people aged 70 to 74 begins, and on the 10th from 65 to 69, and from the 13th from 60 to 64. And there's also been an analysis on the efficacy of the vaccines regarding some 520,000 people aged 60 and above, and the efficacy rate stands at above 86% here, according to a domestic analysis. Now, meanwhile, there is quite a concern regarding variants. There were 97 new variant cases confirmed in the past week, and that's a total of 632 now, most of them being the UK variant. And the most worrying factor is out of the 97, 75 were domestically transmitted variants, so which are linked to cluster infections within the country, and 22 were imported cases. But that's also due to the government's increased analysis on variant cases, which means those DNA analysis. So they have raised that number of analysis, which is also why we are seeing more cases. But the fact alone that we have such a high number of variant cases is concerning.
Right, of course. All right, so as always, thank you very much for that.
My pleasure.
Right, self-driving service robots are playing a significant role at medical centres by offering essential information and a little bit of entertainment while seeking to lower the risk of COVID-19 transmission. Do take a look.
As we enter the fourth industrial revolution, seeing humans and robots working side by side is no longer science fiction. And this hospital recently introduced a newly developed robot that is specialized in infection prevention and control system. Let me introduce Binu.
The first thing you will see as soon as you enter the hospital is this robot, and it checks your body temperature. And if face masks are not properly on, it asks you to wear a mask.
마스크를 착용해 주시기 바랍니다. 손 소독을 원하시면 비누 전면에 손을 넣어 주세요.
This robot also dispenses hand sanitizer.
5G 네트워크를 통해서 들어온 정보를 이용해서 방역 기능을 수행을 하고 여러 가지 안내를 하고 다니는 가장 기본적인 방역 로봇입니다. 밀집도가 높은 곳에 로봇이 출동해서 사회적으로 거리 두기를 시행해 주십시오라고 하는 안내를 하기도 하고요.
In particular, this robot has gained worldwide attention for commercializing the world's first 5G complex quarantine robot solution. Using 5G network and real-time tracking system, it monitors and controls visitor density.
모두의 안전을 위해 사회적 거리를 유지해 주세요.
During the night hours, the robot moves autonomously and disinfects designated areas.
지금 저희가 도입한 이 로봇은 이제 병원 업무의 아주 작은 일부분을 도와주는 로봇이고요. 이것 외에도 환자의 이동이라든지 아니면 검사 또는 여러 가지 어떤 협조에 필요한 부분에 로봇이 이용이 될 수가 있습니다.
It's not just hospitals that are utilizing robots to counter the pandemic. Now we are going to check out another robot that is playing a crucial role at a vaccination center in Yongsan-gu district in central Seoul.
This robot, too, works day and night to provide basic guidance to visitors. There are about 500 visitors a day with an average waiting time of around 10 minutes. To ease their boredom and anxiety, the robot offers a variety of services.
로봇이 춤추는 거 보셨는데 기분이 어떠세요?
너무 좋아요. 너무 좋고요. 기다리는 시간이 지루하지 않고 또 너무 신기해서 자꾸 보고.
You can also have a simple conversation with the robot. If you ask questions about vaccination, it will give you answers.
예방접종 한 다음에 주의사항 뭐야?
예방접종 후 접종센터에서 15분에서 30분간 머무르며 이상 반응 여부를 충분히 관찰하고 귀가 후 평소와 다른 신체 반응이 나타날 경우 의사의 진료를 받도록 권장하고 있습니다.
예방접종센터에서 성공적으로 이렇게 업무를 수행한 이후에는 한 개월 정도 후부터는 민원실을 내서 부정 홍보 동영상을 재생한다거나 간단한 민원 서비스에 대해서 응답을 할 수 있도록 운영할 예정입니다.
Because of the pandemic, now we're living in the non-face-to-face era, and the importance of robot is getting much bigger. We expected robot would be part of our daily lives, and the day has arrived much faster than we thought. This has been 신세경. 안녕.
환자와 밀접 접촉하더라도 코로나19 검사가 음성이고 증상이 없으면 자가 격리를 면제합니다. 14일간 능동 감시를 하면서 총 2차례 검사를 시행할 것입니다.
정부는 올여름 일반 국민의 접종이 본격화되는 시점에 대비하여 예방접종을 마치신 분들이 좀 더 자유로운 일상을 누릴 수 있도록 준비하고 있습니다.
Starting today, if you're fully vaccinated and you're outdoors, you need, and not in a big crowd, you no longer need to wear a mask.
Incentives are being added to public inoculation drives as part of efforts to boost COVID-19 vaccination. Now, for more on these efforts, I have Professor Chung from Hallym University. Good to have you back with us, Professor Chung.
Good afternoon.
And joining this session virtually is Dr. Harold Schmidt at the University of Pennsylvania. It's a pleasure to have you with us, Dr. Schmidt.
Thanks for having me.
Right then, Professor Chung, starting tomorrow, that would be Wednesday, fully vaccinated people will be exempt from the mandatory quarantine following an overseas trip or even contact with an infected person, provided they test negative. But I am aware that this particular exemption only applies to those who've been vaccinated here in Korea.
Yes, that could be a good motivation for vaccinated people, and also a motivation for hesitant who are hesitating to get vaccinated or not. Fully vaccinated means 2 weeks should pass after the second dose of vaccine. For J&J vaccine, it's only one shot, and after one shot, 2 weeks should pass. Then you can acquire a kind of quarantine vaccine passport. I know that there are several countries who have issued a vaccine passport, like Israel, Bahrain, China, and also including Korea. We have a kind of digital vaccine passport, which is named COV. COV is an acronym of CO means COVID-19, OB means overcome. So COOB is overcoming COVID-19. I think that's a very good principle. And after 2 weeks, people consider to have full immunization against COVID-19. I think it's a good measure. But you have to think about maybe one have not full immunity against COVID-19, or maybe during the period of a latent period, and then one might carry another kind of sometimes a variant mutant virus with them and can spread in our society. So we have to look after very carefully whole procedure.
Right. Professor Chung, what are your thoughts on the timing of these eased measures for vaccinated individuals?
Well, this is a good time. even though the vaccine compliance is very high in this country, but still there are a few people who are hesitating to get vaccinated. So everybody is wanting to go abroad these days after more than 1 year's restriction in this country. So that will be a good motive to get vaccinated. So I think it's a good policy. But we need a mutual understanding, because the vaccine were inoculated in other countries than Korea cannot come without exemption. So we need a reciprocal understanding to exchange vaccine passport, whichever country it might be.
Right. Meanwhile, Dr. Schmidt, health authorities in the US have also updated their guidance on face masks for those who've been fully vaccinated. Could you tell us a bit about the new guidelines and the public response?
Yes, exactly. So again, just to emphasize too, this is, you can change your behavior if you've been vaccinated after 2 weeks. So this is not instant. So we want to be mindful of the fact that it takes a while for the body to develop full immunity. And so this is one of the big changes, that we can now, if we have been vaccinated, be in public in non-crowded spaces without wearing a mask. And so I think that the public reaction really has been a mix of relief and apprehension, which seems right. For example, I live in New York City, and we haven't seen a dramatic change in everybody walking around maskless. And I think that's because not everybody is vaccinated yet. We're still working hard, although for many reasons we have higher vaccination rates. And because we need to go step by step. So the key for now is to make it easy for people to get vaccinated so that we can all enjoy these new liberties that we have.
Right. Dr. Schmidt, I understand there are other incentives offered to Americans who choose to get vaccinated. Could you tell us a bit about those?
So the most powerful incentive really is to make it easy for people to get vaccinated in a setting that is convenient for them and that they trust. That is clearly the most powerful incentive that we can put in place for anyone to get vaccinated. There are certainly also other options where universities, employers, some city jurisdictions are thinking about using different kinds of incentives. So for example, a cash incentive or in-kind incentives, T-shirts or raffles or those kinds of things that you otherwise use to get people's attention. And in my view, those things may be helpful at some point, but at this point, the focus really has to be on making it easy for people to get vaccinated in a trusted and convenient setting.
Right, of course. Professor Chung, with regard to the ease requirement for face masks over in the US, do you see this becoming a similar scenario perhaps here in Korea in the near future?
Yeah, I saw their suggestion through propagation. I think that could be a very good reference, but you have to think about our environment. Korea is a very densely populated country, and also very populated and narrow indoor spaces. And also when you go outdoor, also you can see very crowded people over there compared to that of in United States. So we need our own mask mandatory policy in our country.
Right, of course. Dr. Schmidt, you mentioned cash incentives over in the US to boost vaccination rates. How effective has that been, though, in your opinion?
You know, it's a very good question, because I'm not aware of any robust evaluations that would have shown that. And I think it draws attention to one very important part, which is just because somebody has taken an incentive, you don't know that they would not have been vaccinated without the incentive, right? So there's a question about efficiency. If we offer vaccines to everybody, that is very costly, and it may be a waste of money in the cases of people who would get vaccinated anyway. So I'm not aware of any studies that have shown that this is a particularly effective way of getting people vaccinated. And it really has to be about the choice architecture, making it easy for people to get vaccinated, more than simply using monetary incentives in particular, unless that is the case. Money is a barrier for vaccination. So if people are unable to get vaccinated because they are dependent on income, for example, right? We can think about it. But in many other ways, it seems the wrong tool.
Right. Professor Zhang, you mentioned this earlier, but over in Israel, those who've been fully vaccinated are being granted these green passes that allow them access to certain venues like gyms. Have such efforts had perhaps a positive impact on their vaccination rates?
Certainly, when you are willing to go out anywhere, then all of the entrance are restricted so far. But when you have a passport like Israel, then you can go anywhere. And whoever you meet within the facility, those are all vaccinated. So that's kind of a peace of mind that you can enjoy. So whenever I see through a television that they enjoy a hot spring and they enjoy the seashore in those areas, I really envy them.
Me too. Professor Chung, some critics believe that such incentives, however, may lead to more risks than rewards. What are your thoughts?
Intensives are necessary in some part. But sometimes it's unethical, because according to ICH GCP, which handles clinical trials all over the world, GCP means a good clinical practice. It describes that too much incentive is prohibited because it can deviate one's will, particularly in economically desperate people. They can try anything for money. Not for other things. So it's kind of exploiting those people. If you give money and then get as many people to vaccinate. But we have tried everything to get to herd immunity, but putting too much incentives on those programs is not recommended.
Right. Dr. Schmidt, top White House medical advisor Anthony Fauci has said herd immunity is no longer the goal with COVID-19 and that the new goal is seeking to curb outbreaks. What are your thoughts on this?
Yeah, I mean, herd immunity is a difficult concept as it is. It certainly makes sense to reassess the situation as we go along. The bottom line is we want to get as many people vaccinated as we possibly can, and in particular, people who are more likely to get and spread the virus. Right? And that means in particular that we focus our efforts on people who are more disadvantaged, because better off communities live in settings where they can socially distance very easily and are at much lower risk of getting and spreading the virus. Whereas more disadvantaged people are at much higher risk, and that's really where the attention has to be. And this is one other way in which we look at this and say, are we making it sufficiently easy for people who are more disadvantaged to get vaccinated in trusted settings? So that is a very key and important response to make sure that we get to meaningful herd immunity, meaningful protection of people who are most at risk of getting and spreading COVID.
Professor Jung, what are your thoughts about the efforts here in Korea? Because the Central Clinical Committee for Disease Control also believes that the vaccination effort now should be focused more on reducing severe cases and fatalities because COVID-19 looks to become an endemic rather than seeking herd immunity simply. Do you share this outlook?
I think it's not a matter of weighing between two important issues. We should pursue both of them. So I don't think we could achieve more than 70% herd immunity by the end of November, as government suggested. But that is a very important goal. Then we have to do everything to get to herd immunity. Whatever endpoint we will get, maybe end up with a 60% or end up with a 50% or maybe 75%. 70%, the figure is not a very definitive one. It's not a law because it depends on reproduction rate. If you have a low reproduction rate, then you can achieve a herd immunity. But you have a more than 2.0 reproduction rate, then you cannot achieve herd immunity, even though you get to 80%, more than 85%, as Dr. Fauci said. So that is one goal. And protecting the very risky population is another goal. So in Korea, we started against for age group older than 65, and by this month they will start 60 and above. So that's a very good policy. And by doing that, we are reducing the mortality rate or the mortality number these days. So one is not more important than the other. We should pursue both purposes.
Right. Dr. Schmidt, in your view, have authorities in the US set up the most productive, perhaps, infrastructure to encourage public vaccination, or are there things that can be improved there?
Well, I think, there's hardly a situation where you can't improve things. A point that relates to the previous question that has been a unique and innovative measure that has been taken here is to combine a phased allocation system in which we have different priority groups based on risk and epidemiological considerations with what are known as disadvantage indices, which means that within each of the priority groups, we also made particular efforts to prioritize more disadvantaged people before more privileged people. And that is really important for both public health and equity. And that is very innovative, and I think it has been one of the elements that has led to disparities in terms of vaccination uptake not being as large as I think many people would have expected from the outset.
Professor Jung, what are your proposals for Korea then with regard to efforts to boost public inoculation against COVID-19?
Well, we don't know the exact figure, the raw data, because the clinical trials have been done not in this country, but all over the world, in other parts of the world. So we have to wait for their raw data coming out. But my suggestion is maybe after a second shot, maybe in 6 months or so, we need another shot at that time, because all vaccines can induce immunity, and the antibody level is increasing after one or a booster shot. Then, after a while, then the antibody level decreases. If you have an immune cell with a T cell immunity, then you can fight with the virus after a long time later, but the antibody is disappear. So you need another third shot or maybe annual shot in this case. So nobody knows. Maybe the United States will lead this kind of opinion. So maybe, as Dr. Fauci said, maybe in August or early September, they will announce that they need a third shot. Maybe the third shot could be a shot for a variant, not for this one. So anyhow, we'll be still waiting for that. And the more problem is we have done only just less than 70% of the population get vaccinated. So we need at least 50% of vaccination before coming to a fall, because when autumn comes, the respiratory virus activates, and the immunity in our body decreases as environment gets getting colder. So we should focus more on the getting vaccinated people as many as possible and as soon as possible.
Right. Meanwhile, Dr. Schmidt, how should authorities generally seek to perhaps tackle the possibility of discrimination between those who've been vaccinated and those who've not?
Yeah, I think that's a very important question you raised there. So, prevention of COVID is as important as prevention of discrimination, and both are related, obviously. So the key is that we enable all people, especially the more disadvantaged people, to get vaccinated, for whom a vaccine is much more important in terms of public health benefits as well as economically and ethically in many ways because of existing disparities that exist in many countries. So one key measure that is very important here at the moment is, for example, when it comes to ID requirements, right? So in many ways, we have good reasons to require identification for people who get vaccinated, to make sure that they are in the right sequence, to make sure that they are in the right geographic jurisdiction. But in many ways, that can also hurt undocumented immigrants, or in this country, also immigrants who otherwise have reservations about negative implications for using healthcare because of rules that the previous administration had put in place. So making it easy for people to get vaccinated in ways with minimal ID requirements is a way that the whole society stands to benefit, because we all stand to benefit from everybody being vaccinated, especially very high-risk groups. So that really is the bottom line here, that we make it easy for all to be vaccinated. That's what vaccines for all really means.
Right, a very valid point, of course. Meanwhile, Professor Chung, we mentioned this earlier in the program, but the government now is seeking to allocate a greater portion of its current supplies of vaccines as second doses. What are your thoughts on this?
I think the government has done a right thing, because we know that just one vaccination can prevent disease to a certain degree, say 60%, sometimes 80%. So it's a good good thing. But there are many people eagerly waiting for first dose or second dose. So I think the government should have announced in advance that we are going to do this thing and that thing. We have a certain amount of vaccine in stock, then you can get vaccine in 2 weeks' time or in a month's time. But we are still short of a vaccine for coming 2 weeks or so. So people are quite afraid of not getting vaccinated in sooner or later. So that's the still issue these days.
And hopefully it will be solved soon. All right, Professor Chung, as always, thank you very much for your thoughts. And Dr. Schmidt over in the US, thank you very much for your insights.
Thanks for having me.
Right, the success of Korea's inoculation drive depends on two factors, procurement and participation. So do seek to get your shot when your time comes. Now, May 5th is a public holiday here, so join me again on Thursday, same time.